So first
Thank
of all,
you.
let me say thank you for your presentation, which I just really loved. You know, this using digital media as a way of communicating to us about a project involving digital media. I mean, this is totally appropriate, and I was very interested to see the way that you did it. I mean, it's way beyond my capacity, so that was great. Um, and it seems to me like your work in general is very important, and I'm so impressed by the devotion that you have brought to it, and the care and the way that you've really uh, seen autism. It's this fuzzy category, and there's all kinds of folks who have been called autistic, and it's definitely not a one size fits all kind of condition.
Definitely not. Mhm.
Yeah, and I love the way that you emphasize the individuation of the client and the need to follow their needs, which I think is true for expressive arts in general, in
Mhm.
therapy or in other contexts, follow the people you're working with, and then guide them as much as you can in the
Mhm.
relationship. So I have a few things I'd like to talk to you about. One is, how did you get into this field? What brought you into it, and what has sustained you through it?
Before I started my CAGs, I already had this idea in mind of working with visual thinkers or with autistic people because it seems really intuitive to offer them a way of expression that's a nonverbal kind of therapy. So expressive arts therapy seemed like the way to help them explore in their own way. And so the challenge for me was to find a place to do clinical practice, to find the place where they were going to welcome my project. I knocked on lots of doors and they kept on saying, we don't do digital arts with autistic people. I said, yeah, I know. I'm trying to find a new way. And then I was lucky enough to have the director of this center. The center is called Éducation et Thérapie Cognitive in French, and he welcomed the idea of like the possibility of having so that visual thinking exists for people on the spectrum and other types of thinkers, and he gave me the infrastructure to do so.
But you say you had this impulse even when you began CAX. So what was the beginnings of it? I mean, what steered you or motivated you in this direction of working with people who are so-called autistic?
So I've always found autism fascinating. First off, because of this diversity of profiles, the idea that like you can be diagnosed with the same thing, autism spectrum disorders, for a child who's nonverbal to a person who is brilliant and incredibly intelligent. And so I just wanted to know more about that. But I also felt I felt I could relate to some of their struggles, like because I was incredibly shy when I was a little kid, and I had to learn to find my place and to be in a group and be able to um, express myself and find my place in the group. So my extroversion or timidity to a point that it was difficult for me, and the idea that like I do believe that there are different types of intelligence, like multiple types of intelligence, and that current classical schooling is really constructed to teach those that are mathematical and language gifted, and those that are kinesthetic thinkers or musical thinkers or like those that are more gifted in visual intelligence, they're left out. I struggle. I don't think I'm a visual thinker because I think visual thinking means that's your primary way of thinking. I am able to speak and I think but I do think that my visual intelligence is way more developed than my mathematical intelligence. I struggled with that and struggled with other things. So I was looking into how can I empower these people that are very gifted in one particular thing and through their own channel. So if their thing is visual thinking, let's communicate with them through visual input and see
Mhm.
what happens.